a book that I just finished reading, and I suggest the audience read this book. It's called American Sickness, How
Yes.
Healthcare Became a Business. But it's sad that we need people like you, but we need them. So
Yes.
first of all, I'm going to ask you, because this is a very unusual career. So how did you find your passion, and how are you living your passion?
When I left the Texas Medical Center, I mainly did medical video writing and producing, and I did a lot of patient education, and I understood how to get through the maze going
Right,
to
it
the
is a
med
maze,
center.
isn't
Oh my
it?
gosh, it's crazy.
Yes.
A lot of people, get confused, they get bewildered.
Yes.
So I was guiding family members and friends through the med center. And then all of a sudden I realized there was 2 national organizations that did this professionally.
Right.
One was, they're both acronyms, NAHAC, and one was APTA. And so I joined both the groups, and I got started about 3 years ago. And it's kind of an evolving profession.
It's sad that we need it.
It is actually, as much as I enjoy what I do, it is. I mean, it seems like there should be more transparency. It seems like it should be crystal clear, but it's never very clear.
It would take us forever to share with our audience what's wrong with our medical healthcare system. But I want to ask you about the kind of help that you provide. You mentioned that when people call you, there is already a fire. You wish they would start when there's smoke. When there's smoke.
Yes, right.
Can you please share what you meant by that?
Well, I would love to get to the point where I'm doing more education, like I did in the med center. A lot of patient education, where basically people get more proactive, like they're more prepared in advance, like they know where they're going to go in an emergency. A lot of times people, they get sick, they get injured, they jump in their car, they go someplace, and then they call me later with this gigantic bill.
Right.
So if they kind of understood where their in-network places were, right, and had just planned ahead just a little bit, I think they could head off a lot of issues.
They could save a lot of money too.
Yes, and also if they call me like right away, a lot of times they'll call me when they're in collections.
Right.
And
it's kind of late and it's harder.
I've pulled many bills out of collections. I mean, it's possible, but it is harder.
More work.
Because we're triangulating between the healthcare provider, the billing group, the collections agency. We're ping-ponging around. So,
Bonnie, share with me, one of the questions you get a lot is urgent care, emergency care. Now, I've seen these centers prop up everywhere, and I don't know why they're there, and I don't know who covers what. Mm-hmm. Share with me, for example, are most insurance companies covering they're not. So you have this great sign saying, urgent care, come here, but then when you get there, it's not covered.
Well, you have to make sure you know where you're going, because urgent care bills as if it's a doctor's visit. So you're going to get $150 to $300 for stitches. They can stabilize a broken bone. They can rehydrate us. They can do a lot right there. They just can't do CAT scans, and they generally speaking can't do ultrasounds.
But they're not covered by insurance.
Sometimes they are. But the freestanding emergencies.
That's what I mean. I'm talking freestanding.
Those are a different animal.
Yeah, I'm only talking about freestanding.
Okay.
Because obviously, when you have an emergency room in a hospital, most of them are going to be under some sort of network. But these freestanding emergencies that are cropping up everywhere, I'm thinking, oh, these people are making money somewhat. Why? And why are they there?
In 2009, some lobbyists came to the Texas legislature. If you look at their office, they are directly across the street from the Texas legislature in Austin. And they said, hey, we can help with all these huge crowding in ERs by putting up these freestanding ERs. So basically, and we'll be open 365, 24/7, we'll have a board-certified ER doctor, all this sort of thing. So the Texas legislature went ahead and said, okay, they thought these were going to go into high-need areas. Instead, they're next to high-income areas where people have insurance and they have money, and they just charge a lot. So basically, and here's the problem. If like I'm having a heart attack or a stroke, they're going to call 911, and they're going to transport me to a real hospital. So, I mean, I've lost like that hour's worth of time. I mean, and that's important. when that's happening.
Absolutely, when something's that serious.
Yeah, so they have been losing ground with the insurance companies because they overcharge for things. I had a client $6,000 bill for 6 stitches because they just loaded on a bunch of extra tests. He had no symptoms whatsoever. He just needed some stitches. Instead, they did imaging. They did this. They did that. And it's like, it's a little bit much. I told him it's a little bit, 6,000 is a little pricey for six stitches.
So Bonnie, tell me what some of the basic things that people need to know so that when they go into a hospital situation, they start asking questions, or even doctor situation, before they are seen, if they can. Now, obviously, in an emergency room, you're going into an emergency, you don't have a lot of time. But there are certain things that people should say or know before they go into the medical system
Right.
that we have.
Well, first of all, if you're sick or injured, take someone with you. You're not going to be in the state of mind. In fact, there's more patient advocates in the Southern California area and the Washington State area, and when they get sick or injured, they call another patient advocate. There's no way any of us can handle all this when we're in pain or really sick or something like that. Plus, once we get in there, if we're in pain, eventually they're going to give us pain meds, so we're going to be a little altered. So that won't be so good. So you really want somebody there with you to go with you in an emergency. Let's see, what can you do to prepare? Just know that basically, ask questions. Why are you doing this test? What's the working diagnosis?
And is it covered?
Yeah.
A lot of times, is it covered
Yeah.
by how much?
Right.
Now, with your experience, Bonnie, you've been doing this for 3 years, is there a lot of fraud? Is there a lot of stacking bills like, oh, we're going to do this test and this test and this test that you don't really need? Obviously, you're not a doctor, but what are some of the most egregious cases that you're seeing?
Right. I saw a CAT scan for a strep throat.
Not necessary.
Well, and I can always go to the guidelines of the American College of Emergency Physicians and look at their guidelines and pull that up and then ask the ER, why did you do this?
Right.
Because how are you going against the guidelines of your own professional organization? And usually at that point they drop it. But they also overcharge for things. I had somebody go in, they needed a CAT scan. They charged the insurance $4,000. This is why the insurance companies are dropping them. The freestanding ER charged them $4,000 to the insurance, and then they wanted $1,200 more from my client. Well, CAT scans only cost $1,200. So when I called, the explanation was, well, our machine costs $1 million. It's like, well,
Yeah, but
that's not my client's responsibility.
This is the excuse.
Yeah.
I mean, I think I shared with you that I went to South America for an MRI, that in South America, the same machine as the United States,
Yeah.
$500, and
Right.
it was $5,000. But the question is what people can know. For example, it used to be that, let's say something like antibiotics or drugs are way more expensive in the United States than they are in another country. Can you legally go to another country and buy antibiotics or any other medication that you need? Because now they're saying that's illegal to come back and bring those medications back into the U.S.
I really don't deal with that as much as far as just lowering people's bills here.
Okay.
Yeah, that's a tricky thing.
So to prepare yourself to pay the right amount, what's some of the advice that you give? You said take a patient advocate, ask questions. Can you refuse a certain treatment? For example, you said a CAT scan. I have a sore throat. They say, well, you need a CAT scan. You say, no, you know what? I'm going to go to my primary care to do that.
Mm-hmm.
I mean, tell me what you can and cannot do as a patient to protect yourself.
Well, first of all, a good thing to do is not to go to any ER unless it's life-threatening, basically. Because if you have a sore throat,
Go to your primary care or
yeah, or the little urgent cares or something like that.
there's a nurse line too that you can call, 24-hour nurse line.
Yeah, because for one thing, the insurance a lot of times is going to deny it because they want it to be life-threatening. They want it to be life or limb or pregnancy. That's kind of the 3 main areas. So it's, well, so I've had clients think they were having a heart attack. and they weren't having a heart attack. They were having a panic attack.
Right, or
Okay?
anxiety attack, yes.
Yeah.
Yes.
So basically, you can keep asking, what is the working diagnosis?
Right.
What are you trying to find? Because sometimes they just won't talk to you, and they'll just keep doing stuff. And if they say, well, I think you have strep throat, you can say, well, how is this CAT scan going to help how's this going to help you treat my strep throat?
Right.
You just gotta, and that's why you have a friend or family member or patient advocate with you,
Asking questions.
because if you're just dying, if somebody's like, if you have a broken leg, if you have somebody's having a heart attack, that it's really hard to ask questions at that point.
I do have another question which is important, which is, should I call the ambulance or should somebody drive me? Because I understand also that sometimes the ambulances are not covered.
Usually, the Houston Fire Department is covered somewhat.
I had to pay $500 one time.
Wow.
Because I called an ambulance to take me 5 minutes away from here. Remember the Park Hospital over here?
Yeah, yeah.
5 minutes away, and they charged me $500. And I thought, isn't this covered by insurance? And I don't remember exactly why they didn't cover it. So I think that's another question people need to ask themselves. Do I call the ambulance? Well, obviously, if you have a life-threatening situation,
Mhm.
yes. But if somebody can take you, cut your finger or whatever, somebody can take you, wouldn't that be
Right.
easier and better?
Right. Was it Houston Fire Department that did that?
I'm not sure. I don't remember. I
Private
just called
ambulances.
911.
Oh, okay. That's Houston Fire Department. They're billing. Okay, here's the interesting thing about the city is every city in Texas cannot lower its bills. So there's no negotiating with them. So it's probably what happened is your insurance just didn't cover as much. Some insurances will pay more, some will pay less. But there's no really, that's hard to negotiate
But
around.
is it realistic to charge $500 or $1,000 for an ambulance ride?
It's $1,200 and
$1,200 to get into an ambulance ride if
Yes.
you can't, if your insurance doesn't cover it.
correct.
Let me repeat. $1,200 for an ambulance ride that is not covered by insurance. Amazing.
Yeah.
Just absolutely amazing. Bonnie, anything else you want to add that I have not asked you that?
Oh, I
think
could talk
there's so
and
much- I
talk
mean,
and
there's so
talk and
much,
talk.
But I think if they want to contact you, do you have a website?
I do, Houston Health Advocacy, and people contact me all the time. My phone number's on there. I talk to a lot of people after work because I deal with a lot of entrepreneurs and
Okay.
small business people because who has time to
Right,
deal with this?
Right.
So they pretty much turn everything. I've had like 2-inch stacks of medical bills that have gone through. I mean, if you're, one of my clients was flying out of the country all the time. How's he going to deal with that? He's doing business deals in Europe. I mean, how's he going to deal with this? One of my clients was working offshore. So I would hear from him sporadically as he came back and forth. Yeah, it's just,
It's amazing. I think having a professional work with you to help you figure it out, it makes life a lot easier. Hopefully, I'd hate to say this, but I want you to lose your job someday.
and we do too,
Please,
actually.
please.
Yeah.
Just move to Mexico and go to the beach.
Well, I also help people. I've accompanied people to MD Anderson and to doctor's visits because I do speak doctor talk. So I do go with them to help sort things out if they're trying to
Oh.
decide about surgeries or
that's
they're
another
getting.
side of your business. Okay.
Oh yeah, that's another
Okay.
complete
So
side
it's
of my
not just
business.
billing, it's also
Mhm.
you feel uncomfortable, come with me.
Right. Sometimes the communication is broken down with their doctor, and sometimes it just needs to smooth over the waters and get the communication going again. Also, sometimes the person doesn't really understand what their doctor's trying to tell them, and doctors move so fast.
Right.
That they want me to kind of educate them and maybe I did some research once. One of my clients, basically, they didn't feel comfortable with the doctor they were going to see. So when they went into their new doctor, they kind of wanted to know what the international standards were for the kind of treatment they were getting. So I mainly pulled Great Britain and Canadian standards and things like that. I pulled that all together so he was all informed when he went into his doctor to say, okay, I know you're saying this, you want to start treatment here, but they're saying here and here. So basically, he was more informed when he went in to see the new doctor as far as what everybody else was doing.
All right, Bonnie, again, your
Yes.
website is?
Houston Health Advocacy
And your phone number?
is 281-624-6676.
All right, Bonnie, thank you so much for joining us. And if you guys need help with any of your medical bills, or you need someone smart to come with you on your doctor visits, call Bonnie. Thank you so much for watching. Subscribe to our channel. You'll get smarter. Thanks. See you next time.